breathing.
He's struggling to breathe.
Very seriously injured.
Stay on the line and I'll tell you exactly what to do next.
There's just been an accident on the S1 motorway. It's on fire and it's gone into the railway
He's
bridge.
on the line.
How far did he fall? About 5 metres.
He's intubated and ventilated.
You need some of Britain's most elite medics.
Is there any serious bleeding? Yes, there is, yeah.
Can't feel legs, anything below my neck.
We're in a remote location in the middle of the woodland. They've broken their back.
The speed of the Yorkshire Air Ambulance can make the difference between life and death.
Your discretion, take off.
S99 lifted.
Hello, ambulance service. Is the patient breathing?
It's midwinter in North Yorkshire, and Helimed 98 is heading up to one of its most famous landmarks, a huge chalk horse carved into the side of the rugged North York moors.
We responded to a 67-year-old female who was fallen near the White Horse up in North Yorkshire. We've got a crew responding to smash us up as well as mountain rescue. Running wind slightly from the left.
The patient's life is in real danger. She's lying in sub-zero temperatures, unable to walk, and a long way from a road.
Knowing the area as we do from obviously flying from Topcliffe, it is quite steep. So to try and get reasonable access to this lady might be quite difficult. So it might be a bit of a trek downhill or up a hill, whichever we may find when we get there. Some of the White Horses down south are really old, aren't they? They're kind of prehistoric. But I've got a feeling the one at Salt Bank is just like 50, 60 years ago somebody decided it'd be cool if they had a white horse. There's a bit of graffiti, that's what you're saying, basically, yeah. We've got rain ahead, guys.
For paramedics Paul and Al, this is a routine mission made risky by the weather. Helimed 98's heading for a storm.
Icing. Ice forming on the... quite a bit.
It's so cold, the rain is freezing on contact with the chopper.
We'll come down. That's outside areas +1.
If the ice is allowed to build up, its weight could cause Helimed 98 to crash. Pilot Steve must get out of the rain fast.
We're in descent now. We'll get ready to clear of this. You can see the ground there now. There we are, we're just about to come out now.
It stops as soon as it started. But the same freezing conditions are making this rescue even more urgent.
There we are, casualty, 2 o'clock. Visual, yeah. We'll land on the top and go down. On the top and come down.
How are we doing? Mate 2 just arrived at patient side now.
The team's patient is a veteran walker, stranded on a treacherous footpath along the edge of the moors.
A minute. Are you normally fit and well? Yeah. So you've not been knocked out, you can remember everything that's happened to you? Yeah.
Judith Moore is in agony and dangerously cold.
We were coming up the bank. It was slippy, so we were taking our time. I was leading, and I slipped and fell back onto my wife. She hit the ground with me. And I must have fallen on her leg.
Yeah. So you can see something more around your knee, is it?
Yeah. It's like... Yeah.
Yeah. I wonder if you've dislocated your knee.
Paramedic Paul diagnoses a broken leg and a dislocated knee.
Judith's basically come over as her husband's fallen on top of her. She's unable to move her knee as it is at the minute. I'm wondering whether it's more dislocated than that or anything else. She's really cold, so we could do something to keep her warmer.
So if we get the Flexlon on the path, just get her into it, and then we'll get her sorted.
How are you feeling?
All right, just cold.
You're just cold, I know. We've got a nice big thick sleeping bag there for you, though.
Priority really is to insulate her, because the air temperature is probably only about 4 or 5 degrees, and when you're laid in contact with the ground and not moving, you lose a lot of heat, so you get very cold quickly. That's what you like. Where are you from?
Hartlepool.
Oh, they're all tough up there, aren't they? Yeah.
Nice and sunny, sweetheart. Just try and twizzle around on your bum. Give me both your legs.
Stop,
There we go. Okay, right. All we're going to do now is just turn you that way. It's perfect. Now just relax back.
They're wrapping Judith in the Flectalon. It's a fur-lined bag designed to lock in heat.
Right, sweetheart. You'll soon warm up. All right.
How are you doing?
Ground paramedics have trekked more than a mile along the clifftop path.
Hello, love.
This is my old pal here now.
The other boys on the way down.
But there aren't enough people to carry Judith up the slippery bank to the chopper safely.
100 metres to the top.
Well, they'll
And the MRT's on the way.
Yeah,
so
saying they're on the way back.
Yeah.
They're going to need mountain rescue, but the weather's worsening and the temperatures are plummeting. High on the edge of the North York moors, walker Judith Moore desperately needs help.
I'll come inside.
Yeah, just sit on it now. Just sit on find a black bit and sit on it.
A mini tent will shield Judith from sub-zero temperatures.
You'll literally be scorching and you'll not know why you're so cold in a minute.
Surprising how quickly you warm up once you get inside the shelter, although it doesn't look to be much. It traps all the body heat from everybody in it, so the more people can get in it, the warmer you get.
Can I just lift your sleeve up, sweetheart?
And it also protects you from any convection or losing heat to the surroundings.
Paramedics Al and Pete are waiting for mountain rescue to help carry their patient to the chopper.
Let's just whip this over so we can have a good look at what's going on.
They're giving her powerful painkillers. Her injury is agonizing. And they need to straighten her leg.
Try and relax, sweetheart, as best as you can.
Nice long deep breaths, love.
That's it. Well done, Judith. Just try and keep your leg nice and relaxed. Well done, sweetheart. Nice deep breaths on that gas for me.
The team's impressed by her courage.
See up here there?
Yeah. You've done that really well there, Judith. You're right, she's hard. We've got mountain rescue coming out. Okay, so they're going to put you on their stretcher to be able to get you up a lot easier than having to carry you. All right, I think it's got a big wheel on it or something like that.
Oh, you're our ambulance.
Yes, love. We'll carry you up to the helicopter and we'll get you on board there. All right, Joe.
At last, mountain rescue have reached the scene.
Hi there.
Hey, guys, you all right?
Thank you.
Yeah, no,
Stretchers for you.
this is Judith. Judith basically had a fall. Husband's fell on top of her. She's then fallen down. I think it's a proximal tibia fracture.
We'll probably wait on a few more just to lift.
Yeah.
Slide the stretcher in.
Yeah.
Down. Clip up. Load and go.
That sounds good to me. You're the experts.
But the ground is lethal.
Prepare to raise and raise.
Well done, Judith. Good lad.
And prepare to lower and lower.
They're going to use their specialist stretcher to carefully carry Judith 200 metres through the woods up to the chopper. The Helimed team can call on 7 mountain rescue teams, all volunteers who turn out from home or work.
Fade in on the sides.
Without mountain rescue's help, this would have been a risky journey.
And we get to sunshine.
Judith's reached safety.
Okay, tug and glider out at the 2 o'clock. Back radio, Helimed 98, lifting and turning to the north.
Pilot Steve's anxious to get his patient to hospital before the weather turns again. And it's still making its presence felt.
Some hailstone, look. Oh, big pieces as well, look. Wow. Won't be long, Judith, alright, though.
Yeah, thanks.
Helimed 98, NS listed, routed James Cook.
They are heading north, 20 miles to Middlesbrough. Surgeons are waiting to assess Judith's injury.
Helimed 98 Alpha, surface wind 260 degrees, 11.
Thank you.
Judith's hill walking days may be over. The James Cook University Hospital in Middlesbrough covers some of the UK's most rugged countryside, the rolling moors and isolated dales of North Yorkshire. For many of its patients, it's an hour's drive or more from home. And today on the helipad, paramedics James and Andy have an urgent mission.
Yeah, the details are a bit sketchy, but it's somebody semi-conscious after a tractor versus slurry pit accident.
Slurry pit?
Yeah, you're going to get covered in shit.
The accidents happen just 20 miles away as the crow flies. Local paramedics are beating the chopper, but they're a 40-minute drive from Middlesbrough.
That's rotary topping. Oh yeah, I've just marked that, so we're waiting for that to start with. Roger.
Pilot Steve Wardby will have his team at the isolated farm in 10 minutes.
Sounds quite serious. Concerns about airway. We're being semi-conscious. Just that's the first thought that goes through my mind. We'll see when we get there.
Rosedale is a tiny community surrounded by the high hills of the North York moors.
No obvious wires my side. Thank you very much. I bet you've got a bit of a slope actually. Unless you're right by the gate. No, we'll go right up there. Yeah. Got wriggly tin sheets there, guys. Just watch that for me.
Yeah, team. 99 landed.
Claire Dring was driving a tractor when it careered backwards through the wall of a barn. The cause of the accident isn't clear.
How are we doing?
For some reason, we don't know whether there's been a sort of an episode at the wheel or whatever.
Yeah.
But it's rolled backwards. It's gone through that road wall there, which has destroyed it. Taken the end of the wall.
The tractor came to a rest just feet from the slurry tank.
There's the back of the cab, like a glass cab, which was missing, and it's possibly hit a head on some of the wood and the stone structure on the back of that, so we're thinking some form of head injury.
Claire is confused and lapsing in and out of consciousness.
When you say head injury, are we on about with lower GCS or...?
Agitation more than anything.
So probably about GCS 14 maybe.
Possibly at the moment.
Okay.
Claire, nice and still for me, nice and still.
Tacky, ain't she?
Her heart is racing. Paramedic Andy suspects Claire has a serious internal injury, but it could also be caused by a head wound.
I think it's a tacky from that.
I just didn't want to...
No, just going to bob a cannula in.
Nice and still, my lovely, you're doing great.
How did she get up here then? She got out. So she was unresponsive, probably had a bit of an LOC.
Very much so.
So this chap was with her. I thought she was dead, so...
And out cold?
Yeah.
So she was in there, just laid like that, looking pale or anything, or...?
She's completely out.
Like I say, she's mobilised up here, hasn't she? Do you know when she got out then? Did you help her out, or did she just get out herself?
In the battle on the gate for her.
Right. Can you want to have a look at it, mate?
The back of it's obviously out, but you can see where there's the wood and stone look like they've come into the cab.
That wall there, the wall's gone back with it. Bizarre. I don't know whether or not she's just lost it and then that's it not back ahead, but there's some confusion at the minute as to how long she may have been unconscious. So we can only go on really what we're looking at. So.
She's not complaining of being in any pain, is she?
Not at all.
No.
It hasn't from our end.
No.
Claire, can we just ask you yet again, have you got any pain anywhere? No. No pain, okay.
Her confusion and lack of visible injury are making the assessment difficult.
Yeah, mate.
All of this is
The only
just to
injury
make
we
sure
can
you
see
keep well,
is there's some bruising to the left side of her face.
Left side, this just there,
Where
isn't
my
it?
hand is.
Sort of
and the
temple
cheek
area.
As well, yeah.
Left temporal zygoma area.
It's a perplexing case.
Bring her down. All right. Yep. Let us know when you're ready, mate. Just keep your arms in. All right.
But there is a further clue.
Constantly had this right hand gaze over to this way.
Weird, isn't it?
Her head is twisted to the right and the gaze has always been to the right.
Her constant glancing to the right could be a symptom of a brain injury.
Just there. So we've got a bit round here, haven't we? A bit of a lump there.
What is clear is that Claire urgently needs x-rays and brain scans at James Cook. Helimed 99 is going to be heading back to Middlesbrough.
You're doing a good job there. Excellent job.
The air ambulance is always a welcome sight on the moors. It means the local medics can stay to deal with the next emergency, rather than wasting time on the long drive on poor roads to the trauma centre.
Hi, it's Andy on Helimed 99 again. Now, we're wondering whether she's had a bit of a do while she's been in the tractor. or she's got something going on post-incident. Oh, probably about 10 minutes. All right, bye. Bye.
Paramedic Andy is hoping diagnostic tests will answer the many mysteries surrounding this case.
She could have had a fit, she could have had some cardiac event, which has caused her to lose control. Or it could be a mechanical failure of the tractor. Got a fast pulse, which is a bit unusual. If she's had a fit, you could have a fast pulse. A bump to the edge, you could have a fast pulse. So something's not quite right.
Claire is now minutes from intensive care.
Ready, steady, slide.
She's x-rayed and a head injury is ruled out. But she has lacerated her liver. She undergoes surgery and after 4 days is fit to return to the country. It's been a lucky escape. Judith, the woman who slipped on ice near Sutton Bank, was taken for x-rays. She had dislocated her knee and broken her leg. She was in plaster for 6 weeks and will need a replacement knee before she attempts any more hiking. There's a desperate fight to save a tractor driver trapped up to his neck in a lake.
It's sinking, pushing me forward. I need the picture off.
The team's called to a badly injured biker who hit a 200-pound deer.
He had no chance, he braked, came off,